Hi everyone, this is Aurelie Najm reporting for Ramna for Vienna. I am super excited, super psyched to be here. I have selected all of my abstracts and I'm just delighted for all of this science to come. And one abstract particularly caught my attention as I know, and you probably know as well, that transition from psoriasis to psoriatic arthritis is quite trendy right now, and there's a lot of discussion as per whether or not we can prevent it. Obviously, we know what are the risk factors in people living with psoriasis, telling us that they are likely to develop psoriatic arthritis. However, we have not been able, to my knowledge so far, to find strategies that could help us reduce that transition and that risk. And that's how this abstract, which was OP0010, presented by Joban Ibanez and Al, really I found exciting. So they looked at this massive database. Yeah, it was over 200 millions of charts, medical charts that they looked at. And by doing so, um, they were able to see what was the percentage of conversion, a transition from psoriasis to psoriatic arthritis, and looked into whether or not there were differences according to what drug these people would receive to treat their psoriasis. So they did adjust to quite a few different risk factors for psoriatic arthritis. And then they looked into TNF inhibitors, IL-12, 23 inhibitors, IL-23 inhibitors, and IL-17 inhibitors. And the results are quite striking to me, really. So what they show is that if somebody is treated with an IL-12, 23 or an IL-23 inhibitor, the risk of developing psoriatic arthritis over the follow-up over the 3 and 5 years time points was lowered by 37 and 39%, which is a lot. It's less, it's more than 1/3 less patients that develop psoriatic arthritis compared to TNF inhibitors. And that was for those patients that were treated with these drugs in first line. Now, those people that were treated with the IL-23 inhibitors or IL-12, 23 inhibitors in second line, their risk of developing PSA was also lowered for about 30% compared to TNF. And they also compared the risk in people treated with IL-23 inhibitors and IL-17 inhibitors. And what they saw is that the risk to develop PSA within 3 and 5 years was lowered from roughly 50%, 1 out of 2 in people treated with IL-23. So what does it tell us? First of all, um, there's always the risk of channeling bias, in this type of studies, and that's something we need to acknowledge. But that's not what I want to emphasize. What I want to emphasize is that there's a question there, and it's telling us something about pathogenesis and understanding. And the first one is, we know that IL-23 inhibition does work slightly better in the skin. And so is it just because we control psoriasis better than we prevent people to develop psoriatic arthritis? Or is there some specific mechanism of action by blocking IL-23 that does reduce the risk of joint disease? So that's definitely something I think that worth following up and investigating. Because if that is a thing, then, it would support the fact that people with high risk of developing PSA would be treated preferentially with this mechanism of action. So that was it for me today. That's what I wanted to share with you. Follow me on Twitter, Aurelie Romo, and follow Rome Now for more content throughout the conference.